Diaphragmatic stimulation is an effective tool for controlling respiration and has been useful in breathing disorders. Left ventricle is in close contact with the diaphragm, and diaphragmatic movements may affect left ventricular systolic function. In an initial report, 35 patients were evaluated within 7 days of an open heart surgery. Hemodynamic impact of pacing-induced diaphragmatic stimulation and ventricular pacing configurations were tested. Successful diaphragmatic pacing was documented by fluoroscopy and palpation. Left ventricular systolic performance was recorded using electromechanical activation time by acoustic cardiography. 18 patients were tested in the cardiac catheterization laboratory and 17 in the intensive care unit. Electromechanical activation time significantly improved when the diaphragm was stimulated 20 milliseconds after the onset of ventricular pacing. Diaphragmatic pacing could be induced with or without causing symptoms. Left ventricular systolic performance improved in both instances. These patients were neither pacemaker dependent nor in heart failure. A case report of synchronized diaphragmatic stimulation in chronic heart failure was published in March 2022. Synchronized diaphragmatic stimulation device provides imperceptible chronic stimulation of the diaphragm through a laparoscopically implanted system. The system consists of an implantable pulse generator and two sensing and stimulating leads affixed to the inferior surface of the diaphragm. The device delivers imperceptible R-wave-gated pulses that alter intrathoracic pressure, improving ventricular filling and cardiac output. The person in the case report had previous myocardial infarction and persistent heart failure with NYHA class 3 symptoms despite standard therapies. He had improved quality of life, exercise tolerance, cardiac function, and NT-proBNP through 12 months of follow-up. A research letter has also been published on synchronized diaphragmatic stimulation for treatment of symptomatic heart failure in March 2022. This was a first-in-human, single-arm, open-label study which enrolled 15 persons with symptomatic heart failure with reduced ejection fraction and NYHA functional class 2 or 3 and ischemic heart disease. They reported an implant success of 100%. No implantation procedure or device-related adverse events occurred during the 12 months of follow-up, and patients did not sense the ongoing diaphragmatic stimulation. Left ventricular ejection fraction improved numerically in all patients. Significant changes in heart failure relevant parameters were observed at 6 months post-discharge, particularly in whom a synchronization level of 80% or more was achieved. This synchronized diaphragmatic stimulation device has not yet been approved for sale. These are only proof of concept studies. A United States investigational device exemption clinical trial under FDA breakthrough as a prospective multi-center randomized safety and efficacy trial with 250 plus patients is being planned by the authors. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video.